Most people believe colon cancer happens suddenly. They imagine someone feels extremely sick, goes to the hospital, and receives a shocking diagnosis out of nowhere. But the truth is far more dangerous, because colon cancer rarely appears overnight. In most cases, it develops slowly, quietly, over many years. And in the earliest stages, your body often tries to warn you. The problem is, the warning signs are subtle, easy to ignore, easy to explain away. Many people mistake them for stress, for aging, for something they ate, or for simple digestive discomfort. That's why colon cancer is one of the most preventable cancers, yet still one of the deadliest. Not because we don't have the tools to stop it, but because too many people wait too long. In this video, you will learn the early warning signs that people ignore for years, who is most at risk, and most importantly, what you can do right now to protect yourself. Stay until the end, because one simple screening can truly save your life. What is colon cancer? Colon cancer begins in the large intestine, also known as the colon. The colon is an essential part of your digestive system. Its job is to absorb water from food waste, process nutrients, and move stool through the body. Every day, your colon works silently in the background, keeping your digestion moving normally. But sometimes, small growths can form inside the lining of the colon. These growths are called polyps. At first, most polyps are harmless. You won't feel them, you won't notice them, and they may not cause any symptoms at all. But over time, some polyps can slowly change and become cancer. This transformation often takes 10 years, sometimes even longer, which means colon cancer gives many opportunities for early detection. The tragedy is, most people don't recognize the signs until the disease has already progressed. Why colon cancer is often missed? Colon cancer is often missed because symptoms develop gradually. The signs resemble common digestive issues. People feel embarrassed talking about bowel changes. Many avoid screening out of fear, and pain usually appears late. That's what makes colon cancer so dangerous. It hides in plain sight. So now, let's go through the early warning signs that should never be ignored. Sign 1. Changes in bowel habits. One of the earliest warning signs is a persistent change in how you use the bathroom. This may include diarrhea lasting more than a few days, constipation that doesn't improve, stools that become thinner or narrower, or the feeling that you cannot fully empty your bowel. Many people ignore this. They assume it's something temporary, something they ate, or a minor stomach bug. But here's the key word: persistent. If bowel changes last longer than 2 or 3 weeks, your colon may be sending a message. A growing tumor or a large polyp can partially block the bowel, changing stool shape and movement. Your bathroom habits are one of the clearest windows into colon health. Never ignore long-term changes. Sign 2. Blood in the stool. Blood in the stool is one of the most important warning signs of all. It may appear as bright red blood, dark tar-like stool, or hidden blood that only shows up in lab testing. Many people immediately assume hemorrhoids, and sometimes it is something minor. But blood in stool should always be evaluated, because colon cancer can bleed slowly over time, even before pain begins. Small amounts of bleeding, week after week, can be an early clue that something is wrong. The rule is simple. If you ever see blood, don't ignore it. Don't guess. Get checked. Early detection saves lives. Sign 3. Unexplained abdominal discomfort. Colon cancer can also cause discomfort in the abdomen. This may feel like cramping, gas pain, bloating, pressure, or ongoing mild stomach aches. Because these symptoms are so common, many people dismiss them. They think it's just indigestion, or it's probably stress. But when discomfort becomes frequent, persistent, or unusual for you, it deserves attention. Your body knows what normal feels like, and when something changes, it's worth listening. Sign 4. Unexplained weight loss. Losing weight without trying can be a serious warning sign. Colon cancer may cause weight loss because the body uses extra energy fighting disease. Appetite decreases, digestion becomes disrupted, and nutrients aren't absorbed properly. If you lose weight unexpectedly, especially alongside other symptoms, do not dismiss it. Unexplained weight loss is not always good news. It is often the body's way of signaling deeper illness. Sign 5. Constant fatigue and weakness. Many colon cancer patients report feeling tired all the time. Even after resting, even after sleeping, they still feel exhausted. This often happens because of anemia. Slow bleeding in the colon reduces red blood cells, which lowers oxygen delivery throughout the body. As a result, you may feel weak, lightheaded, or drained for no clear reason. Many people blame stress or aging, but fatigue that does not improve should never be ignored. Sign 6. Iron deficiency anemia. Iron deficiency anemia is one of the most overlooked clues of colon cancer. It may cause weakness, pale skin, dizziness, shortness of breath, cold hands and feet. In men and postmenopausal women, iron deficiency is especially concerning because it often points to internal bleeding. Doctors frequently investigate the colon because slow bleeding may be the cause. A simple blood test can sometimes reveal an early warning sign. Sign 7. A feeling that something is not right. Many people describe a general feeling that something is wrong. Not sharp pain, not one clear symptom, just unease, a change in normal health, a sense that the body feels different. This instinct matters. The body often senses illness before the mind understands it. Never ignore persistent changes. Trust yourself enough to get checked. Who is most at risk? Colon cancer risk increases with age over 45, family history of colon cancer or polyps, a diet high in processed meats, low fiber intake, obesity, smoking, heavy alcohol use, inflammatory bowel diseases like Crohn's or ulcerative colitis. But it's important to understand, even healthy people can develop colon cancer. That's why screening is so powerful. Screening does not wait for symptoms. It prevents cancer before it starts. Prevention and screening. Colon cancer is one of the most preventable cancers in the world. Screening can find polyps before they ever become cancer. The most common and effective screening is a colonoscopy. Doctors now recommend screening starting at age 45 and sometimes earlier for high-risk individuals. Lifestyle prevention also includes eating more fiber, reducing processed meats, staying physically active, maintaining a healthy weight, not smoking, limiting alcohol. Even small daily habits can reduce risk dramatically. Prevention is powerful, and early detection is life-saving. Final message. Colon cancer does not appear overnight. It grows quietly, slowly, over time. But the body gives warning signs. Changes in bowel habits, blood in stool, unexplained fatigue, persistent discomfort, unexpected weight loss. The earlier you act, the better the outcome. If this video helped you, subscribe for more life-saving health education. Share this with someone you love because one screening can save a life.